is Nixon St Bernard, and today I'll be discussing a topic, endocarditis, that related to health, and this is pertaining to my AMP2 class. So today I'll be talking about what is endocarditis, the signs and symptoms, the cause it and who is at risk, some of the complications, preventative measures, how endocarditis is being diagnosed, and finally we're going to talk about the treatment. Okay, so as a nurse working in the healthcare field, I've been seeing a lot of patients with endocarditis, and I choose this topic because I find I relate and getting a lot of experience with patients that been diagnosed with endocarditis. Okay, so to begin, endocarditis is an infection of the heart. That's the main target organ. It infects the endocardium, the inner lining of the heart. It also infects the blood streams. It usually starts with an infection with bacteria, fungi, or germs from other parts of your body, such as your mouth. Bacteria spread through your blood streams, and thereafter the inner chambers of your heart. And some of the signs and symptoms, some related to endocarditis are non-specific. And when I say non-specific, I mean you might have sweating, chills, generalized weakness, and it just creates some discomfort in general, like achy joints, sleepiness. Sometimes some patients experience weight loss and fatigue, low urine output, and hemoptysis, which is medical term for that is coughing up blood. Again, not all these signs and symptoms here are significant to endocarditis. Every patient show completely different signs and symptoms, but these are the more significant signs that being shown. Causes and who is at risk for endocarditis. People who are IV drug users that use needles. To be plain talking, I would say like dirty needles, and sharing each other needles, or knowing the other person's risk for diseases. People who have artificial heart valve that related to rheumatic heart disease, dental procedures such as cleaning your teeth to the dentist, oral hygiene by brushing your teeth with a hard toothbrush cause your teeth to bleed, that allow bacteria to get into your bloodstream. But one of the main cause of endocarditis, again, is people, IV drug users, and tattoos, sharing needles. Complication of endocarditis includes long-term damage to the kidneys that related to low urine output, heart failure that related to rheumatic heart disease, an enlarged spleen, which is an infection of the red blood cells and high white blood cell count, and eventually death. Prevention with endocarditis. One of the main direction for endocarditis prevention with patient is avoid IV drug use. Recognize some of the signs and symptoms, like generalized weakness, fever, malaise, which is sweating. Get yourself checked up, call your doctor, or procedure that may cause any skin infection by sharing needles as well. Okay? Endocarditis is being diagnosed in the hospital when they're going to diagnose anyone with endocarditis. Most of the time we do blood cultures, and the blood cultures should be drawn in a 12 to 48 hour period. Blood cultures should be taken from 3 different sites. Also an elevated white blood count over 10,000. Protein in your urine are mostly seen in the blood, and it mostly show up in like 50% of the people infected with endocarditis. Again, a white blood count over 10,000. People who are anemic are seen in 90% of the patients, and people who have like damage to the heart valve related to rheumatic heart disease. And the treatment, most of the treatment for endocarditis, the first line treatment is a combination of penicillin and aminoglycoside. The aminoglycoside that we mostly use in the hospital is gentamicin. And these treatments usually take 4 to 6 weeks with a central IV insertion. So the main goal of the treatment is to get rid of the infective organism. Some of the alternative treatment that we also use for mild symptoms, we use aspirin that will help take care of fever. We encourage patients to do adequate fluid intake. We do a lot of education on nutritional intake, and we strongly recommend bed rest. So I think I did touch on all of the topics, and I hope it's very interesting and educational and informative to everyone. Thank you very much, and I'm looking forward for everyone's feedback. Thank you. Bye.